Pediatric hospitals around the country are drafting and enacting plans aimed at boosting health care capacity during the coronavirus crisis. Children's National Hospital, one of the country's leading pediatric medical centers, is prepared to accept adult patients after expanding its admission criteria for the first time in history to bolster the DC region's hospital capacity during the coronavirus crisis. In the event that regional hospitals see a surge of adult patients, Children's National will accept patients under 30 years old who are showing respiratory symptoms and who may or may not have tested positive for COVID-19, a spokesperson tells U.S. News. The pediatric hospital, which opened in 1870, will also admit patients in their 20s with cancer or sickle cell disease if other area hospitals become concerned about capacity during a surge. While the facility does care for a small number of young adult patients under limited circumstances, hospital officials say their response to the pandemic is unprecedented. This would be the first time the organization has significantly expanded our admission criteria, the hospital says in a statement. The 323-bed hospital has not yet admitted a young adult patient who falls under the new, expanded criteria. Children's National is also working with other regional hospitals to expedite the transfer of pediatric patients so those hospitals can free up beds if needed. We understand that hospitals that primarily serve adults may reach capacity during a surge, so we developed these plans to provide these hospitals with the opportunity to serve more patients, the statement says. Children's hospitals around the country are making and enacting similar contingency plans in light of the COVID-19 pandemic, though they have differed over whether to admit adult patients. Children, in general, have been far less hard hit by the coronavirus than adults. Children's Hospital Colorado and University Hospitals Rainbow Babies and Children's Hospital in Cleveland have reportedly both indicated that they are prepared to take on adult patients. By contrast, hospitals including Lurie Children's Hospital of Chicago and Nationwide Children's Hospital in Columbus, Ohio, have said they are only willing to accept pediatric transfers from other hospitals. Though there is some regular, seasonal patient movement between local hospitals and nearby children's hospitals, and children's hospitals accept other patients during natural disasters, the widespread creation and adoption of expanded admitting practices across the country is unprecedented, says Amy Knight, Chief Operating Officer of the Children's Hospital Association, which represents more than 200 children's hospitals in the U.S. The association in April released guidelines stating a preference that pediatric hospitals continue to treat young patients. It urged children's hospitals to first prioritize pediatric transfers from other regional hospitals in order to free up hospital beds in facilities that care mainly for adults. Hospitals should next consider adult transfers, the guidance said, though it acknowledged that different areas would have different needs and should take different approaches. Accepting young adults should in most cases be the second line of defense to free up hospital beds, Mark Witeka, the organization's chief operating officer, says. Children's hospitals are better equipped to deal with patients in their 20s than they are to treat older coronavirus patients, who often have underlying conditions like diabetes, cardiovascular issues or renal failure, conditions far more prevalent in older patients, Witeka says. Adult patients with those conditions are better served by specialists used to working with adults, not children. At the same time, however, children's hospitals, and especially intensive care units in those hospitals, are not necessarily ideally equipped to deal with patients in their 20s. The masks, the equipment, the pharmacy, all the dosing, the nursing staff, everyone's kind of geared for really small people, Witeka says. He noted that it doesn't mean children's hospitals are incapable of treating older patients, just that it might be more challenging and is something individual hospitals have to take into consideration. One thing many hospitals around the country right now have at their advantage is time, Witeka says. Most regions have yet to see a coronavirus-related patient surge significant enough to strain the hospital system and necessitate the transfer of patients, pediatric and adult alike, to children's hospitals, giving health care systems time to prepare and craft a plan that will work most effectively for their area.